welcome to Lakeside Live, an integrative health series featuring local practitioners focused on holistic healing. So today, Dr. Meister and I would like to welcome integrative psychiatrist and founder of the Trinergy Center for Integrative Psychiatry, Dr. Aruna Tummala.
Thank you, Danielle and Dr. Meister. It is my pleasure to be here, and I know we've worked together for many years, but this is a more formal way of doing this. I'm really excited to be here.
Yeah, we love collaborating with other local practitioners. I think it's a huge benefit to our patients to be able to provide that service and kind of take the guesswork out of adding another provider to their wellness team, because that can be something that causes an immense amount of stress for people, which we'll be talking a lot about stress today. We chose the topic of integrative mental health for this episode because this time of year people really end up struggling. The weather, all the extra comfort food, lack of sunlight,
and relationships. Relationships, the classic joke of, when you speak at the Thanksgiving table. They can be stressful, but
seeing family you haven't seen in a while.
But there's a way to navigate all that.
Absolutely.
Great time to be talking about this.
Yeah, it's perfect. So here at Lakeside, our doctors frequently address conditions, help identify and address the root cause of things like fatigue, stress, adrenal fatigue, similar to what you focus on. But when it comes to addressing more severe anxiety and depression, that's where we really refer out to other practitioners like you, people who specialize in that more. And I think for most patients, we refer out to Trinergy for that. So if you could start by telling us a little bit about who you are, how you got into integrative psychiatry.
Absolutely. So I am Aruna Tummala. I am a board certified psychiatrist. I'm board certified in adult and geriatric psychiatry. I was always fascinated at the interface between the mind and the body. That's why I chose geriatrics, where we are dealing directly with the brain more so than in other areas of psychiatry. But really what made me going down this path of integrative medicine is really becoming a mother. And to be honest, I had a lot of chronic diseases. I had PCOS, I had Hashimoto's, I was pre-diabetic, and I would blame my mom because this was her lineage, is what I thought. Because this is all genetics, and that was my thinking because that is what I was trained in. But around the time that I was trying to get pregnant for the first time, a young patient of mine, she came to me with a magazine, National Geography magazine, that compared the blood levels of toxins in Americans, both adult men and women and children, to that of their counterparts in Europe. And what they found is on all these tests that they did, the blood levels in Americans were far higher than in their European counterparts, and they were linking that to various diseases, whether it was asthma or autism or diabetes and cancer and all of that. So I was a new immigrant to the United States, and I had no idea about any of these things. But because I wanted to become pregnant, I really did a deep dive, and right then my husband and I, we decided to clean up what we were eating and clean up to some extent the products that we were using, but I had no idea at all. Then throughout my pregnancy, I naturally fell back on the ancient wisdom that exists in many Indian households. So I would reach out to my mother-in-law, my mom, for things during the pregnancy. Like I remember and they've started sending me different herbs for me to take. Like it would be ginger, which we all know, ginger for nausea. But in the 4th month, to make my babies have really good complexion, they sent me saffron, which I was supposed to drink every night in milk. So I started doing all of that. I didn't question because I knew that this wisdom has been passed on for thousands of years. And then when throughout my delivery and everything, I was on a very prescribed diet, and I was a very, very obedient partaker of all of these things. And I felt better. I didn't have any complications, which most women don't. But and then for that first year and a half as I was nursing, both my mom and my mother-in-law asked me to consume a lot of ghee, clarified butter.
Yeah.
And I would do that, and I would see it in my breast milk. If I didn't have enough ghee, the milk would be watery. But then when I went to my primary care physician for a regular checkup, she was like, "Oh, your cholesterol is through the roof." It was probably a little closer to 200, and I was in my early 30s. And I was like, it doesn't matter, I know where it's coming from and I'm doing it for a reason. So then I began to get this conflicting information from all these different sources, but my intuition was to fall back on the age-old wisdom that I was raised with. So my kids didn't get any soda, they didn't even, we didn't do any fast food, so I really became very focused on that. Second time I became pregnant, I was working at a local psychiatric facility, and I would not eat at the cafeteria, but that same food was being fed to the patients. And naturally I began to ask, what is that doing to their overall health? If I don't think it's good enough for me and my developing baby, how can it be good enough for anybody else? Because what do you see in any of these hospitals?
Yeah, that's something that has always blown my mind.
Yeah.
Is the food that is served in hospitals and the vending machines with soda and chips and candy.
Oh, Veterans Affairs. I remember the first time I went, my husband was doing a project for Veterans Affairs in Palo Alto, California. This is in 2004. He works for the IT industry. And I went there because I was preparing for USMLE and I would go there to the library. But when we went down to the cafeteria, it was Burger King, McDonald's, and I was like, how can this be?
How is this a foundation of health in a hospital?
But at that time, no, it was only after I had my babies and I really became very focused on what I was feeding them and myself. This question about diet and mental health came, and thank God for Google, it directed me or the universe to the right organizations. So in October 2013, I went to my first conference with American Board of Integrative and Holistic Medicine. It's now called AIHM, Academy of Integrative Health and Medicine. And I felt two very competing emotions. Number one, I felt very angry that I did 2 psychiatric residencies and a fellowship, spent a lot of money and my time to learn nothing or to learn the wrong things. But I was very exhilarated that I was finally getting to learn the right way of doing things. And from AIHM, I was introduced to a lot of modalities: naturopathic medicine, chiropractic medicine, Ayurvedic medicine, Chinese medicine, functional medicine, and so many other things like Feldenkrais and names that I had not even heard of. But for me, Ayurveda and functional medicine, they're very similar. I became drawn to it, and this is what happens when physicians attend this particular conference. It's kind of like a mixed bag, and we are encouraged to pick and choose what speaks to us personally. So I chose Ayurveda and functional medicine, and the next couple of years were devoted to me getting my diploma in integrative and holistic medicine, and I started my training in both Ayurveda and functional medicine. And I tried to bring that back where I was working. And that's when the witch hunt started, and I lasted.
Wasn't well received.
Not at all, not at all. And I would try to actually bring articles in mainstream journal. Like I remember I found this case report of a 17-year-old boy with schizophrenia who was hospitalized for close to 2 years, and he had not done well until his mom, who was a dietitian, insisted that the treatment team put him on a gluten-free, dairy-free diet, and many of his symptoms improved. And that was a case report in American Journal of Psychiatry. So I printed that, gave it to my colleagues and to my bosses and said, look, if it can happen to one kid, how many are we missing? But it would fall on deaf ears, and I remember I don't want to not name any names, because this is unfortunately the sad reality of not only mainstream medical facilities but also mainstream psychiatric hospitals, even to this day. Even to this day, that's a sad part. So naming any one particular institution doesn't get us anywhere. But the program director of eating disorder, because facility there, for them a bag of Cheetos would count towards a snack, and I would literally pull my hair out. Look at the dyes, look at the Franken food ingredients in this. That's all inflammation, and there is no caloric value, there is no nutritive value. What are we doing? How can this qualify? And then when I began to introduce this concept that not all food is created equal, there are good foods and bad foods, and sometimes, and in Ayurveda we talk about the specificity of that. It's salads. Everybody, we think in the Western culture that salads is very healthy. But in Ayurveda, no. What is good for one may not be good for others. So if you don't have a healthy digestive system, salads are not going to be good for you. You're going to make more toxic. Too much cold,
Yeah.
yes. But also, you're not going to digest, and any undigested food will remain as toxic waste and will trigger inflammation and leaky gut and all those unhealthy processes. So even seasonal variations too, like, especially foods that require more digestion are supposed to be taken in the lunchtime, as opposed to dinner should be our lighter meal, lunch should be our main meal, and the same thing during winter season, eat foods that are more easily digestible. So soups, and this knowledge exists in all cultures.
Yes,
right?
And it's something that people have practiced forever.
I mean, why is it that we don't make spiced cider or spiced wine in summer? Why do we do lemonade? Because lemonade is cooling, whereas spiced cider is heating. And we don't do, in every culture, even Starbucks, I always joke, they come up with pumpkin spice latte only for fall and winter. Thank God. But and they're not going by the science behind it. I mean, they're going by the market trends. But really, there is a lot of wisdom and science. So,
absolutely.
So this was my journey to becoming a holistic psychiatrist. So in 2016, I decided that I needed to quit, because I mean, really, the freedom to innovate and to think freely outside the box and to do what is in the patient's best interest is what drove me. And I did walk out on my job to literally nothing. But I knew that when patients get better, then things will all fall into place. We don't have to make a deal with anyone. We don't have to settle. Neither we as practitioners and patients, for that matter.
Yeah.
And I think that's probably pretty similar to what brought you to naturopathic medicine, seeing people actually heal, individualized, and looking at the whole person.
Yeah.
Tell us a little bit about.
I was pre-med through undergrad. Like, I knew I wanted to be in medicine since a young age. That's something I was, set on. And in college and high school, I was able to shadow nurses of different specialties and rotations, and I was really able to see a lot in that short amount of time. And what was really shocking to me was the chiropractors that I was also shadowing at the time were promoting longevity and health, and they were also like living the medicine, right? Like, they were super healthy, they were fit, they would work out on their breaks or their afternoon, break time. Whereas when I was at the hospital, and it's nothing against both groups of people, it's just what I was observing. The breaks, the nurses actually didn't really get breaks, and the breaks that they did have, they would have to consume the food that they would have. So it was just two different realities of a way of living, and that itself made me think about life a little bit differently, and then just healthcare in general. And then I was also experiencing a lot of my own acne battles and stuff like that at the same time. So I was seeing a dermatologist. I had been through a lot of different pharmaceuticals and nothing was really working. And so I finally landed on Accutane, the last option, really. And I was desperate at the time. I was in college. I was ready to be done with acne. And I didn't care about dietary approaches. I thought, I'm living healthy. I'm running 3 to 5 miles a day. I'm I am healthy.
Yeah.
I didn't guess that, I wasn't considering, the alcohol I was drinking, the food I was consuming, and the cafeteria of a college cafeteria where they're not really serving the best food.
Yeah.
And so after finally getting all of the side effects from Accutane, joint pain, I started to read up on really bad cases of people taking it, and I was there's no way I'm gonna take this if it's gonna compromise my joints or my cartilage. Because there was just some side effects listed as that, and also my digestive health was kind of going to the wayside from it. So after that, I wanted to see a doctor that was in natural health care, but went to medical school. So I just searched and found a naturopathic doctor nearby, and just the first visit alone, in comparison to watching how many doctor's visits in the hospital and in private care, that it was an hour long. It wasn't 15 minutes or 5, and she really wanted to figure out what was going on. And she really emphasized the diet, and I had never taken that seriously because the dermatologist had brought it up, but it wasn't something that was a primary focus, and I was much more motivated at the time to really focus on diet, and after a month of gluten and dairy free, I really saw a lot of changes, and it kind of went from there. So after that, I just transitioned my applications to naturopathic medical school.
Lucky you.
Found it early, but
yes. No,
not an easy road though.
No,
yeah.
And that's where, so the acne was actually a gift.
Yeah.
It was a blessing in disguise. And for me too, the PCOS and with struggling with infertility, anywhere I would go, it would be as if the universe was lining up all the pregnant women right in front of me.
Yeah.
So I went through all that, and I really thought that it was, I'm doomed. But I've been able to reverse all these conditions for myself. So
a chiropractor told me that too once, that I was shadowing, that like all of the things that you learn as your own health like really can impact your patients too.
Yes.
And, like,
So what you were talking about before with seasons and seasonal eating, I think there's also some wisdom there for seasonality as far as activity, and for almost all of time, winter has been a season of rest.
Yes.
It's been you work all spring, summer, fall, make sure you have enough food to get through the winter, you rest and recuperate. But in society today, we don't have that. Everybody keeps working, there's constant stress, and I think even more stress during the winter, holidays, get-togethers, shopping, all the expectations. So what do you think about, doesn't it make sense that we might be more tired this time of year as opposed to
definitely
in the summer?
Yeah, because I mean, it's colder, there's less light, we're naturally inclined to feel tired because of that alone. And a lot of us, like you said, are go, and we don't take time to actually rest, and it's like shunned in our society to rest. So like in the winter time, we really have to emphasize rest. And this time, like winter solstice is coming up, the 21st of December, and that's the time to bring light back into the world and spend it with your family inside, kind of like animals hibernating.
Yes. Yeah. Oh, I do agree with that, and in fact, I would even challenge that we call this tired. It's not tiredness, in the classic sense. It's not fatigue. It is the natural way that our bodies and minds require that hibernation. I think I prefer the word hibernation simply to remove that connotation that comes with tiredness, which implies that needs to be fixed again.
Yeah.
Whereas we do need to hibernate. We do need to slow down.
Yeah.
And this needs to happen really on a daily basis as well.
Yeah, absolutely.
And that's why once we establish a daily practice of, and waking up early is necessary for that. There's no shortcut out of it. Yeah. And especially for our teenagers and young adults, I saw this article a couple months ago, which basically, this was from a mental health clinic that caters to teenagers, which basically was arguing that in today's world, modern teenagers are they're sleeping late and waking up, like sleeping from 2 a.m. to 2 p.m. is okay. It's almost normal. I'm like, no. Talk to any society that is agricultural and is tied into the rhythms of the natural world. This is not, kids are depressed, they're anxious, and they're also using their social media and phones way too much. But let's not normalize that this kind of a sleeping pattern is normal.
Right.
And they quoted something about melatonin levels also being, no, that's a reaction. If you find that the melatonin levels are abnormal, that's a sign of abnormal physiology. It's not the cause of lack of sleeping. So, there's so much gets distorted, with regard to the understanding about our physiology. And that's why really I think we all need to fall back on ancient medical texts, even for immunology. And I will tell you, there was so much of conflicting information thrown at us with regard to the immune system in the last 2 years. And I had to go back to my textbook of pathology to reread the immune system and how it operates. And I was like, because I had to really recenter myself.
Absolutely.
So, and we haven't changed that much. We are still the same human beings. Except our immune systems are pretty much.
I saw a quote like, our genetics haven't changed that much, but we have changed.
Our environment.
Yeah, our environment has changed, and that is part of the reason why we see more cardiovascular disease, more mental health, like all of these things are environmentally related.
Completely.
Lifestyle related.
Lifestyle related.
And stress.
Stress, yeah. Stress, I mean, according to some studies, 90% of primary care visits are because of stress. They may present with a stomach pain or joint pains or asthma attack. They're all because of stress.
Yeah.
Yeah, absolutely. And even the CDC, I was talking to Dr. Meister earlier, it blew my mind that I looked that up, and the CDC even says 90% of all illness is stress related. But then why aren't we looking at stress as the root cause and addressing from there in medicine? And I think that's something that both of you, are really great at. Could you talk a little bit more about how, what symptoms you see as a result of stress and how you kind of approach those?
Yeah, sure, I can start. They can range from a variety of symptoms, from like wired and tired, headaches with lots of stress, muscle aches and tension, chronic fatigue is a big one. Anxiety and depression are also symptoms of stress. Anxiety, it's interesting because anxiety is the most common mental health disorder in the United States, but it's really similar to just feeling stressed out. So I have a lot of patients often tell me, oh, I don't have anxiety, I just have stress. Like, it's just situational. Whereas anxiety is also, it's longer than just the situation. It'll be recurring.
Right.
So really looking at also like the root cause of the stress, we kind of talked about a little bit. Of that stress, it could be, even a hormonal imbalance, like low thyroid, stuff like that. But that's like the common symptoms that I'll see too.
Yeah, I would second what Dr. Meister is saying, and stress, the way to think about stress is that it can have, it does have a physiological effect and it has a psychological effect. So that way, practically any organ system in the body will be affected by stress. So that's the physiological manifestation of stress. And the psychological manifestation can range from anxiety, depression, to even psychosis, from acute psychosis. 20 years ago, studies showed that even patients with schizophrenia, the risk of relapse would be higher for when there is a lot of stress around them, especially within the families that they're living, as opposed to when families are more understanding and have positive warmth and regard, then the risk of relapse is low. But if there is more expressed hostility and things like that, then that increases risk of relapse.
Well, the child trauma.
Childhood trauma.
Yeah.
Yes, absolutely. So in fact, maybe this is a good segue to talk about the 3 root causes that I commonly see. It's bad diet, or the standard American diet, trauma/stress, and under trauma I include both head trauma specifically, as well as psychological trauma, especially early life trauma, and even trauma that can happen at different phases of life cycle, and toxins. So DTT, diet, trauma, toxins. These are the 3 root causes that I find. And the common pathway is inflammation through the gut. So leaky gut inflammation. And from there, it can affect, especially for us women, it's either the thyroid or our reproductive hormones. They get affected. And for men too, we are seeing low testosterone as a really common reason why men are not able to, when men feel tired and fatigued, and also their stress resilience comes down. And the same thing for us, so that situational anxiety that your patients are talking about, yes, it's not an anxiety disorder per se, but we could think of it as the early stages of an anxiety disorder.
Yeah.
And even more earlier than that is actually this inability to tolerate stress. To me, even that is something that we need to pay attention to.
Well, when we can address the stress, we can actually prevent the progression of anxiety, like you're saying.
Yes. Yeah, and because addressing the stress is bringing the body into balance, and then and when we say stress, it's never about the outside, right?
Right.
It's not about your breakup. It's not about bad score on your test. It's not about somebody cutting you off. It's on the road. It's not about that.
Yeah.
Stress is all how we perceive it and what we are responding.
Yeah, and understanding triggers in
yes.
childhood. Yeah.
Yeah.
Well, and so we're talking about anxiety, stress is the root cause here. So the National Institute for Mental Health estimated 19.1% of US adults were diagnosed with anxiety last year.
Mm-hmm.
Do you think that if we're knowing that there's other root causes, is that an overdiagnosis?
No, I would say at least in certain specific groups, like I've seen statistics that young adults, college-going young adults, the rates of anxiety have gone up to 25% or more. I would, if anything, I would say that probably is an underdiagnosis.
Okay.
Because so what about drug addiction?
Right.
Especially with marijuana, even cigarettes. They're all, before they can come to us and say, I'm anxious, any young kid or young adult, they're already doing these things as a way to cope with their symptoms. So that, if you take into consideration all of that, or anger outbursts, which is what, the teenagers' emotional ups and downs that happens, they're all, to some extent that is part and parcel of a young teenager learning how to cope in our world and learning to become an adult.
Right.
But it could also very easily veer into a pathological state, depending on the other factors that we talked about.
Right. So I guess what I'm getting at is, could it, instead of being anxiety, which is what they're diagnosed, could it be adrenal fatigue, or could it be leaky gut just presenting as anxiety, and that's just a symptom of a larger root cause?
Oh.
Does that make sense?
Yes. Yeah.
Okay.
So
I've seen that more with, I've seen that probably with anxiety too, but also with depression, I would say.
Okay.
Because people who are taking antidepressants but they're not getting better, there usually is another root cause to why they're low mood. So looking at, again, the thyroid, again, can produce low mood. It can also make you feel really sluggish and tired. So that kind of goes back to like the seasonal depression where you're more affected in the seasons. Well, if that depression, or if you feel like that low mood is persisting past, the winter months, or it could even happen in the summer, just more rarely, then that would be a case where you would want to go, oh, is this actually depression, or is this something else? That's what I would see.
Yeah, I guess I should have said misdiagnosed.
in fact, I would actually be a little controversial. I don't mind being, and as a psychiatrist, I can tell you.
Yeah, you can tell us.
Yes.
Yeah, that's why you're here.
Yes. Well, the real truth is that none of the psychiatric diagnoses that we have in the DSM-4 actually tell us anything about the root causes. It's just a fancy name. You could call depression anxiety and anxiety depression. You could call it that. You could switch it over. You can call schizophrenia autism. It really doesn't matter. They are all atheoretical, symptom-based diagnoses that a bunch of white men, to be specific. And I'm not saying this, and I'm not saying this with any...
It's just a fact.
It's just a fact. And actually people, there's a researcher out from UK, his name is James Davies. He has actually written books and done wonderful presentations about how we need to rethink the whole psychiatric diagnostic framework, because it is atheoretical, especially in today's age when we know so much about the gut-brain connection, the microbiome. Going back to a symptom-based diagnosis, it's like saying you have fever. What is the fever from? Is it Lyme disease, or is it flu, or is it COVID? Just saying somebody has fever has no potential value to the patient and to the physician. There is no value. It's the same thing with depression. So, and that was my biggest struggle in mainstream psychiatry, is that, hey, these diagnoses don't mean anything except, and this is where, again, something controversial, but it is very true. If you look at all of these diagnostic categories, they are linked to big pharma medications. So you mentioned antidepressants, depression, antidepressants, anxiety, anti-anxiety medications, schizophrenia, antipsychotic medication. But again, they're based on a faulty chemical imbalance theory that over and over again we do meta-analysis about serotonin levels or dopamine levels, and we come up empty-handed. So I mean, I know that other psychiatrists, and even just in summer 2022, Joanna Moncrief, she's a wonderful psychiatrist from UK who's been working in this field. She presented a wonderful meta-analysis looking at all the serotonin studies for depression and said, hey, I have looked at 40, 50 years of research looking at serotonin and depression. There is no chemical imbalance, but it's been crickets from the mainstream community.
Right.
But
Well, I think some patients have seen that in themselves. They've tried a variety of different classes of medications. They haven't seen results.
Yes.
And I know another doctor who specializes in mental health said that to me with her patients as well.
Yes.
So
Yeah, and that is where my hope is, because even if the authorities are not recognizing it, but patients are, and they know when they take these medications how it makes them feel. They're not getting better, and then they're experiencing side effects. The most common side effect that I hear is emotional numbing. So I'm not depressed, yes, it's not making me cry, but I don't feel anything.
Yeah.
I think it's also though important to bring up that although these types of medications can be looked at in a negative aspect, or even just as a band-aid to the root cause, I guess, what are your thoughts? My thoughts are that can help a person get through a troublesome time. Sometimes that's indicated, and it can help us find the root cause while also providing that patient with some relief. Like, anxiety, I know that, just different anxiety medications can help a lot of people, just ground themselves quickly while we can search for the root cause. Like, what are your thoughts on that?
So I used to think that when I first switched from mainstream to the integrative thing, but I can tell you that in the last 6 years, close to 6 years of doing this kind of a work, what I've realized is that that kind of thinking is also misinformation related. What I mean by that is that I started off, even as trying to change my practice to more holistic thing, I realized that I had this understanding that natural supplements or natural medicines or diet is not going to be as fast or as effective as this chemical pill that I can give. But time and time again, I've been proven wrong.
I think that's why I find giving the cofactors for the nervous system, like B complex, making sure they're activated B vitamins. So what that means is checking methylcobalamin, so B12, that's the active form, versus just cyanocobalamin. So another, like, feeding the pathways in the right direction, allowing the body to take those ingredients and make whatever it needs to make to help balance out whatever's deficient or low. If it's low dopamine, low serotonin, and I know you're kind of saying that that theory is not necessarily proven, but I have found that just in general, lots of B vitamins, especially under chronic stress or even in gut dysbiosis, has been really helpful, especially even like you keep talking about gut health.
Yes.
And we know a lot that the dysbiosis can affect your mood, and I find a lot of patients tell me, I have anxiety when I'm also having all these constipation issues or loose stools, and they can relate that back and they can tell me that. And that's when I say to them, yes, you're being in tune with your body, you're really listening to yourself. And I think there was a study with LPS, which is an endotoxin from bacteria, that was injected in rats, and as soon as the rat was injected with the LPS, the serotonin dropped immensely, and so 90% of your serotonin is made in your gut. So if that's just happening from bacterial overgrowth, we can only imagine what happens to the rest of the body just from bad digestion, bad gut health.
So with regard to the chemical imbalance, the best way to think about it is it's not that there is low serotonin or high serotonin or low dopamine or any. It's actually what we lose in any disease for that matter is the nuance behind it. Like, our cells know what to do and when to do it and how much to do it. That nuance is lost. Because of lack of nutrients, because of inflammation, because of LPS, that nuance is lost, and we need to restore that nuance. So then our cells, whether it's a brain cell, if it's a brain cell, then that brain cell can decide, right now is the time for me to make more norepinephrine because it's 6 a.m. and I need to wake up. Or it could be later on in the evening and it says, I need to make melatonin now. Or it could be, when, somebody's hugging me, I need to make oxytocin. So that nuance is what we need to restore. So it's never about high or low, it's about the balance. And this purely comes from Ayurvedic medicine, which is all about balance. It's about restoring that intelligence within our system and allowing our system to find its own balance.
Okay.
So, and all we need to do is we need to give the right diet, we need to address the trauma, and we need to detox. So actually maybe sharing this patient story would be very clarifying. So I'm working with a 26-year-old young man who became psychotic about 6 years ago. And very bright young man. He did manage to graduate from college. He started a business that, he concluded it, he finished it, but just a downhill course over the last 6 years. And he has been in and out of hospitalizations, residential treatments, the best treatment in the country. I will mention, he was at the top program, residential program. It's the McLean Hospital in Boston for 3 months in their schizoaffective disorder program. And even though he was there for 3 months, he was not getting better. This is after on and off treatment for many years. And so I saw him for the first time on August 4th. He was very suicidal. He was very psychotic. He had delusions and hallucinations non-stop. He was over 100 pounds overweight because of these medications that he had been taking. And so this program that he was at, they were at their wit's end, and they had put him on 85 milligrams of olanzapine, along with 1500 of Depakote and 900 of lithium, and metformin as a pre-diabetic, kind of to prevent the diabetes, plus propranolol and lorazepam. Now, to give our listeners an idea, 20 milligrams of olanzapine is considered the maximum dose. I have personally not given anyone beyond 25. There is no evidence in psychiatric literature to support that. This person was on 85 milligrams. It's insane. And he was not getting better.
And what that was probably doing to his body with the side effects.
Yeah, he's not only obese, he's actually developed lower lung atelectasis because, the obesity didn't allow his lungs to expand. So we are finding out, but he's 26, he's going to get better. But here's the thing, with everything that we did, the last day that he was psychotic or suicidal was September 10th. So August 4th to September 10th is when, and he's steadily, and really what I've done is diet, trauma and toxins, and for him, really spent a lot of time addressing his psychology. And I shared this example, and I'm still working with this young man. He's not, so I've been able to cut down his olanzapine to about 50 milligrams. He's off of the Depakote. He's at 450 of lithium. And he has lost about, I want to say, 25 pounds.
Okay.
So there is a long way for us to go with him. But he started to do volunteer work. He's writing a book, a fiction book, and he's doing pretty good at all of these things.
Yeah.
Main complaint right now is anxiety.
Okay.
That's what we are dealing with, but we are seeing, so he developed myocarditis with one of the medications he was given, clozapine. So that I truly believe that the anxiety that he's complaining is to do with his lung and heart issues. So we're getting him a cardiology and a pulmonology referral. So really, as you said, we have to look at the root causes in the body. But and his story is not usual. If you look at any chronic mentally ill person, even schizophrenia and bipolar, they are maintained on these medications, but they are not getting better. Many of these patients end up on disability. Whereas if they come off of the psych meds, they actually are able to regain full recovery and functioning, even though they may have symptoms. They may have symptoms, but patients, when they come off of these hardcore medications, within 1 to 2 years of starting them, are able to restore functioning in their lives. And I'm not saying it. Martin Harrow or Harlow, I will send the information for interested readers.
Yeah.
But he did, and he's a psychologist out in Chicago, University of Illinois, and he's done, recently he published a 20-year follow-up study with schizophrenia patients and looked at whether they were on long-term medications or whether they did only short-term medications. And he did another study which was a 5-year study, then a 10, and now he did a 20-year follow-up. And consistently what he's shown is that yes, you will need some of these medications for symptom suppression in the first 1 to 2 years. And after that, the most beneficial thing that we can do is help these patients come off of them. And that's where in Martin's group, they're not doing the holistic approach. But even then, when they come off of the medications because the main reason why those patients came off is because of the side effects.
Right.
So even without doing the whole diet trauma toxin approach, these long-term studies consistently show that staying on antipsychotics increase rates of permanent mental health disability.
Okay.
That's not only bad for the individual, it's bad for our society and for our financial health of our nation.
Right.
So what are your thoughts on, since I think most of our listeners may resonate more with anxiety and depression, just for example, how would you say that this approach of getting off of medications is indicated for, and doing the diet trauma toxins like you've been saying, has been helpful for and is it hard for you to get patients on board with this kind of plan? Because for someone who may have felt a lot better on the medications, how would you approach that kind of patient?
Well, I mean, if they're feeling better, then my question would be, what is their reason to come and seek someone like me? That would be I want to know why that they're doing.
What if they just want to, what if they're just curious, they want to have some type of integrative healthcare, they want to have an integrative psychiatrist like yourself.
So frankly, when they experience symptom relief with the medications, they're still having their gut issues because that hasn't gone away. It's just the symptoms have been suppressed. So if when people are in tune with themselves, they know that, I'm having irritable bowel syndrome, and I still don't handle my stress very well, and I don't feel, that emotional numbness is also, at least these are the reasons why people who seem to have some sort of normalcy restored with the medication, but they're still feeling that something is amiss, something is not fully there, and that's why they come to me more often than not. And at that point in time, my job is to simply educate. So everything that I'm saying here, I can support that with studies like Martin's study, and that has been the case even for, long-term use of antidepressants. There was a Finland study where they followed up prospectively, looking at rates of suicide. The expectation was that suicide rates will go down, but no, over 10 years, suicide rates and completed suicides actually went up in this cohort of adult women. And what about number of depression episodes? We saw that there's more cycling of depression episodes, sometimes cycling into a bipolar kind of a state.
Right.
So if you look at the long-term stuff, so the best book that I can recommend, it's called Anatomy of an Epidemic by Robert Whitaker. He has documented all of the long-term studies in that book. So that is a good starting point for many of our listeners to actually become educated about the real state of science when it comes to mental health and mental wellness and of course the psychiatric medications.
Well, and I think that most people, if not all, in my opinion, would benefit from either seeing a naturopathic doctor or an integrative psychiatrist, depending on their concerns. I think that American culture and our society today lead people to, no matter how healthy you may think you are, you may have migraines or you may just feel not good. You know that something's wrong. You feel that in your body. And I think that focusing first on things like nutrition, lifestyle, supplements. We actually had somebody ask about stress's influence on the nervous system. So just even the influence of stress bringing in your nervous system, how does that affect things like adrenal fatigue, Dr. Meister?
Yeah, so for those that aren't familiar, adrenal fatigue is essentially a word used to term low cortisol or chronic stress. So with a lot of my patients, we do cortisol testing, and it's part of just looking for answers, really. So when someone comes to me for stress, we're looking at a variety of different things, but adrenal glands and how your hypothalamic pituitary adrenal axis is all communicating. And so our adrenals are these glands that sit right on top of our kidneys, and they help to regulate stress. They also secrete epinephrine and norepinephrine, which are our fight or flight hormones. But along with that, they also secrete cortisol. So when we look at the cortisol rhythm, most of our hormones are highest in the morning. And cortisol has this unique diurnal curve where it goes high and then it goes low, and it goes a little bit high in the afternoon for the afternoon peak, and then it goes low at night. So often what happens with just not having a regular sleep pattern, chronic stress, staying up late, lots of caffeine, alcohol intake, trying to combat that stress, we're going to have a flipped cortisol curve, or just a depleted cortisol curve, or we could have just really, really high cortisol. So all of those different pictures would lead me to different treatment approaches. And one thing that we use a lot here are adaptogenic herbs or botanical medicines. And just based on the person's presentation, do we need to calm their nervous system or use more calming herbs like holy basil, or do we need to use more, just balancing herbs? You kind of talked about balance earlier. We would use like ashwagandha, for example, or do we need something more like stimulating to really like rev up the engine? Like, is this person really defeated or deficient and depressed? We would use like rhodiola to help uplift them and give them more stimulating energy. So this is where like the individual approach comes into play with my practice, and this is why not everything that you pick off of the shelf is always going to help you. And along with just looking at the adrenal, once we kind of look at the adrenal health, we have to also consider your thyroid and your sex hormones, because they all kind of work in like a triangle. I always do this with my patients. So if one part of the triangle is off balance, it's going to take away from other areas. So the thyroid or your sex hormones, such as low progesterone for women or low testosterone for men, are common. And those also produce mood disorders. We already kind of talked about hypothyroidism a little bit, but that, like, an increased need for thyroid medication, if you have hypothyroidism, that would be another sign of adrenal fatigue or some other reason of why you're not producing enough thyroid hormone.
Right. And that all is tied in with your nervous system, correct? And do you deal a lot with nervous system healing?
Oh, yeah.
And that's...
Yeah, so in terms of the stress effect on the nervous system, right? So the way to think of it is that our nervous system becomes very excitable, or more like Tinder. So even somebody's saying something harshly to you, your partner is a little frustrated and says something harshly to you, and you can end up having a meltdown, not able to recognize that your partner is just frustrated, it's not really about you. That's because your nervous system has become like Tinder. So yeah, stress can directly contribute to that. So that's why, now we are seeing so many holistic and health and wellness experts talk about meditation and grounding, because that's one sure way to mitigate the effect of stress on an activated or Tinder-like nervous system.
Right.
So,
and also, I really believe that, like, and also just the way that I think about it, like, when we support the cofactors, when we have lots of stress, for example, it depletes our B vitamins. If we're drinking lots of coffee, it depletes our B vitamins. And those are all cofactors to your nervous, like, to your, I just lost my train of thought. But basically to your nervous system and your neurotransmitters, that's the word I was looking for. And so when you replete those levels and you can, like you said, ground yourself. If you have more anxiety, you should do yoga, you should do breath work. But for depression, you should do more stimulating exercise, like HIIT workouts or, early runs or something like that.
Right, and even creating a routine for yourself daily.
Yes.
I've heard waking up with the sun. You should be looking at the sun within the first is it like 10 minutes, 30
15
minutes?
to 30.
Yeah.
Okay.
Mhm.
Difficult to do now, but
Yes, it is, but
but we do it. We have to, yeah.
and have either of you seen giving our viewers some tools that they can take from here? Things like the happy lights. Have you seen
Yeah,
benefits of those?
I recommend those a lot to my patients, but I first recommend just going outside. Just go outside in the morning, 15 minutes. It could be as short as that amount or up to an hour. And you could even go at, like when the sun is the highest. So you don't have to go early in the morning, but I do recommend if you can't sleep at night to go early in the morning, right when the sun rises, like 7 a.m. But the happy lights work as well for people who can't get outside because it's cold out. So you just put it up and you have it on while you're getting ready, eating breakfast. And a lot of my patients like those too.
Yeah, and it might seem extremely difficult to some people, I feel like, because it's counterintuitive to what they may be thinking. So for depression and I'm tired or I'm depleted, I'm going to grab a cup of coffee, but that might make it worse depending on what the root cause of their symptoms is.
So much of it is the language that we use for ourselves, and and so that's why I like to use imagery through my language. So I'll say this to everyone, to all the listeners. Process of healing is a romancing of you by you. It's like falling in love with yourself. Like, let's say you're in a new relationship, you might be feeling very tired, but if your partner asks you for something, you will get up and do it. Or you are you have a child, That's for us women, when we have children or pets for that matter, we will do what needs to be done for our loved ones.
Yeah.
And it's the same thing. We have to view this process of healing as falling in love with ourselves, and that's actually a central core. As I said, trauma is one of the root causes, and how we address that is by creating self-love and self-worth. And so the process of healing is really a falling in love or a romancing of you by you,
Romanticizing your life.
Yes, and the way you do that, everything, whether it is you're cooking for yourself or waking up that extra 10-15 minutes so that you can move, or you're spending time reading a book that is going to uplift you, or spending time with people that uplift you, or saying no, creating boundaries for yourself. All of these are acts of self-love. So and especially choosing the right foods for oneself. So a lot of it is how we talk to ourselves. And these are some of the foundational change in thinking that needs to happen.
Yeah.
Right?
Absolutely.
So if it's like, oh, I gotta do this, and oh, I gotta do yet one more
Change
thing.
it to I get to do this.
Yes. Or I'm doing this because I love myself.
Yes. Yeah. Absolutely.
I always recommend people, like, when they're doing these changes, like, it can be a lot to change your routine, to change your diet. Like, that's scary. That's really daunting for a lot of people. And I know for myself back then, like, that was, like, really hard to, like, let go of the dairy. But I find that, like, if you can do it in a way that's, like, enjoyable, like, especially the exercise piece. If you're not already exercising, if you can do it in a way that's actually enjoyable for you, you're actually going to exercise. So listen to a podcast, walk with a friend, like, have an accountability partner. Then you're going to create, like, opportunities for you to, like, love your lifestyle versus, like, dreading that workout that you have to do.
Yes, absolutely. So in our closing here, if you could give your one best recommendation for viewers to take through the winter to help their overall mental health or stress levels or just a healthy lifestyle, what would it be?
Okay. There's two, actually. I always say, because there's the physiology and the psychology. So for the physiology of our body, please make sure that you poop every day first thing in the morning.
That's a good
must.
one. I agree.
That is a must. And to make that happen, get into the habit of drinking a glass of warm water or lemon water. Very, very simple techniques. And maybe that's the other thing. Getting healthy is not hard. The process of it can seem a little hard, but to become healthy is not hard. So the first thing, drink warm water, move in the morning so that you move your bowel movements first thing in the morning. You have a bowel movement, sorry. The second thing for the mind is actually going inward and grounding yourself, whether you do it for a minute, 5 minutes, 10 minutes, 15 minutes, whatever is you can allow yourself. So that one thing for the body, one thing for the mind. These are the two things that I would encourage everyone to incorporate. Just go inward, just go. And the simplest way to do this is you close your eyes, sit up straight, your neck and spine in alignment. Bring your attention to the point in between your eyebrows. Take a couple grounding breaths, only through the nose, and then with your inner eye, check in with your body, toes on upwards to the top of your head, and check in with your mind. That's it. Takes a couple minutes, it's very grounding, and you get to know yourself.
And it seems so hard to do, but it is. I just recently started meditating again. I lost the practice for a bit, and I noticed my stress levels going up through the roof. And I've been doing it for about 2 weeks now, and when I first started, it seemed like such a hard thing to even take 5 minutes. I was like, oh, I'm so busy, I don't have time for this. But we all sit on our phones for at least 5 minutes a day, every day. Give yourself that love and that time in the morning. I feel like, because everything else in your day, you rush. This is the one time where you're pouring into yourself and really giving to yourself.
Yeah.
Mine would be mine kind of goes back to the diet. We didn't touch too much on like specifics, but I think the biggest thing that could really change anyone's life is paying attention to how much sugar you're eating. There is sugar in almost every packaged food, and even in our fruits, and like our frozen fruits. So really start paying attention to the sugar that you're eating and lowering the amount that you're eating on a daily basis. So like a good goal is like less than 5 grams per serving. So with that in mind, like go check everything in your house and take anything out that has added sugars, fake sugars, like artificial sweeteners that can have drastic effects on the gut health, especially sugar alcohols. And then
sugar alcohols like erythritol?
Yeah, so like xylitol, anything OL in the ending can disrupt gut health, and a lot of people notice that. If they take those out, they'll feel a lot better. So if you're chewing gum a lot, gum has erythritol or xylitol. And so if you're chewing gum a lot and you have a lot of GI issues, I would take the gum out and just see if you feel better. But the second one would be, again, we really honed in on the routine, but that is like the biggest thing that you can do for yourself. Even if like there's always going to be days that aren't going to be perfect, and you're never going to have the perfect amount of motivation to do that workout or to set enough time for 8 to 9 hours of sleep. But those fundamentals are key to your overall health, and I hope from even Dr. Tummala here, emphasizing that as a psychiatrist, you can understand that that's what us naturopathic doctors really hone in on, is the sleep, your diet, your exercise. If that's not in place, then we don't have a good foundation. The house can crumble. So really focusing on savoring that energy, putting it in the savings bank versus like spending all of the energy that you have to go throughout your day.
Absolutely. I think those are great recommendations. We'll close out here. Thank you for joining us, Dr. Tummala. I will tag everybody's Instagrams in the live so everybody knows where to follow both of you. And check in with us. We've got some exciting events coming up. Dr. Meister has a gut reset. We're talking about how gut impacts your mental health. And Dr. Tummala has workshops typically. Do you have any workshops coming up?
Actually, what I'm actually working on is creating an online program. So that should be up and running by January. So it'll be an easy way for people to. If they are local, I prefer in person, but we are seeing more and more people are not local. So that's why we are. So this whole program of changing diet, addressing trauma, and detoxification, we offer it over a 6-month period.
That's great.
Yeah,
very
it's start to finish. Yeah, it's start to finish, and this is the program that has worked for us so far. We are just making it more easily accessible to everyone, online or in person.
That's amazing.
So we'll be launching that pretty soon, so stay tuned. And to everyone's health, and happy holidays.
Yes, happy holidays.